My pregnancy was going well, and then had an ultrasound at 29 weeks where they found out there was no amniotic fluid. That's when they told us they knew something was wrong with the kidneys. They weren't exactly sure what. At one point they said if he were to make it through birth, there was a less than 5% chance that he would survive. They immediately are breathing for him using different types of machines on him right away in the delivery room. I got to hold him for maybe a minute. They told us he wasn't going to make it and that we needed to decide if we wanted to keep him on life support and not be able to hold him, but just let him go naturally kind of, or take him off life support and be able to hold him in our arms.
It's just a roller coaster when you're in the NICU with somebody that has the issues that he had. You just take it day by day. It was really that same day that they told us that news that things started to turn around and get a little bit better. He
started dialysis at 8 months old. He was on it for a year. Prior to transplant, he would throw up 10 times a day, typically. He was very late and just sitting up, crawling. He wasn't walking at this point, even though he was 18 months old. We knew the end goal in all of this was going to be a kidney transplant. That's when he would be his healthiest, is when he would finally have his transplant. It was amazing, all the people who applied to be his donor, like really humbling. Dan was also in the process of going through all the tests to see if he could be the donor during that time, and we found out that he was a match.
We just feel blessed that I was able to do that. We were just lucky that I was a match. I think they said, you know, I would have only been a better match if I were like a twin, so it couldn't have worked out any better.
Meeting with Dr. Hoffman, just super personable and made us feel comfortable. We knew that Jack was going to be in good hands.
I didn't really have any anxiety for myself. It was more just anxiety because I knew Jack was going to be going into surgery. Wake up at I'm not sure what time, but first question, how's Jack? And they let me know everything was great.
All of us in the waiting room were wearing our kidney crew shirts. Then Dr. Hoffman was ready to talk to us. The surgery was over and we met in a little room where she told us everything went well. It was surreal to know that my little 1.5-year-old had his dad's kidney in him, and that this was really the start of a new life for him, where he's not throwing up every day and feeling miserable every day on dialysis for 10 hours a night.
We're gonna take each day as it comes and hope that it lasts him for 15, 20, 30, 40 years. Knock on wood.
He's definitely a daddy's boy, and they have a super special bond.
So I actually met Jack when he was 1 day old. And so I met him over in the NICU over at Children's Nebraska. And at the time I saw Jack, he was critically ill. Not only was he born with kidney failure, but his kidney disease had also greatly impacted his lung development. So he was also in respiratory failure at that time. We really didn't even know if he would make it, despite all the advances that we have in all this new technology. It really took a huge multidisciplinary team with both kidney doctors, neonatologists, lung doctors, dietitians to really care for him. Jack has always been resilient. Even in the most critical of situations, he has really made it through and impressed us all with how well he's done. So I've seen Jack and his family through some of the hardest conversations in their lives, and also some of the best conversations they had when discussing kidney transplants. I always start off my transplant evaluations with, what are your goals for him? Because we really take an individualized approach to medicine and what his dreams are, what my goals are to get him there. I love seeing my patients and their families in the community. One of the best things about kidney transplant is how well they do afterwards. Just by looking at Jack, you wouldn't even know he had a kidney transplant. He just looks like any other happy kid out there playing, being happy. And it's just really wonderful just seeing the family just having as much of a normal life as possible and doing things that normal families want to do. Right now he's thriving, and he's about 1.5 years after transplant and doing remarkably well. We have the only pediatric kidney transplant program in the state of Nebraska. Nebraska. So not only do we care for patients in the Omaha area, but we have patients driving hours away to receive care here. They come here not only because we have great outcomes both for patient and kidney survival, but really because of the individualized approach that we take, not only to improve their clinical outcomes, but also to improve the quality of life of both the patients and their families. This not only depends on the wonderful surgeons that we have, our kidney team, but really the really impressive multidisciplinary team that we have here at Nebraska Medicine. The wonderful child life specialists, the pharmacists, the dietitians, our inpatient, outpatient teams. It really takes a whole community to care for these patients. Our transplant program here is very remarkable. Not only do we do kidneys, livers, multi-organ transplants, but we really take care of patients as a whole community. Our transplant teams interact, so not only are we improving transplant care in one part of the transplant program, but we're really taking a whole team approach to improve care. We do a lot of cutting edge research here, so not only can we improve the lives of our patients in our community, but then our overall goal is to improve care for transplant recipients nationwide. I think it's really the culture of this place. It's everyone has together that we take a patient-centered approach, and their goals are really our goals, and we really work as a team to get them the best outcomes.
The entire surgical experience was great. We still talk about how great Dr. Hoffman was, but everybody that surrounded her. We've had conversations with people that are kind of in the same boat as we were, having almost the exact same experiences that we did, but we have this facility and all these doctors right in our backyard, and we hear stories of people having to drive hours or even fly to get the care that they need.
It really does feel like a family. All the nurses and his nurse coordinator, we see them out at events for different organ transplant, Rally for Life and Blue and Green Day and things like that, and we talk to them out at those events and just coming to appointments. I mean, they make Jack feel special and not afraid to come to his doctor's appointments. So we're really blessed in that way. We are a 1.5 years post-transplant, and Jack started preschool a couple months ago. He's thriving, wrestling with his older brother. He's now become an older brother. Just how great his life is now that he has a new kidney and is healthy. There's nothing I would change about our experience. We feel super fortunate that we live in a state that has this facility. Without a doubt, we don't want to do it all over again, but if we had to, we know that we're in good hands here.